Hey cousins, welcome to Brown Liquor and Bad Ideas.
Welcome, cousins, to this episode of Brown Liquor and Bad Ideas. I'm your host, Cornell Wright, the People's Lobbyist. In this episode, we're going to talk about we're moving into the fourth quarter of our fight against the COVID-19 virus. Welcome, have a quick one with me. Cousins, today is St. Patrick's Day, and a toast to all my Irish cousins out there and to all the other cousins who want to be Irish for the day. And for my personal story is last year, March 17th, 2020, I actually went to a bar, actually two bars, and had corned beef sandwiches and beers, my favorite bars, and that was the last time I was in a bar for the past year. That evening, in the state in which I live, they closed down and shut down all the bars at that point in time. Cousins, I understand that's a first world problem. I understand with all the problems we've had, that's minor. However, it is indicative of a milestone. We're still not back to bars now. We still can't do that. But let's talk about some of the issues and some of the things that have happened over the last year that I think we need to keep in mind as we move into our fourth quarter. So you ask me, why do I say fourth quarter? For many of you who are basketball fans and football fans, when your team comes up and puts up the four fingers, that means it's time for the fourth quarter, which we're going to bear down in order to win the game. If you're behind, we're going to do what we have to do to catch up. If you're even, we're going to do what we can do to get ahead of our opponent. And if you're ahead, you're going to keep the momentum and finish out the game with a victory. Cousins, I submit that's exactly where we are now. Now, we all know, and I'm sad to report, that there's over 530,000 cousins in our country who have died as a result of COVID-19. That is sad. There's even a larger number of those cousins, and almost I bet every one of us knows someone now who has either had COVID and is in the process of recovering. A couple of weeks ago, I was on a panel discussion on the Tom Flicklin radio show in which three of the other members of the panel actually had COVID-19. One fellow tells a story in which he was in the hospital for 40 days and had two near-death experiences. Cousins, as you could hear his voice, he was still gasping for air as he was going through and as he was talking. He's out of the hospital, he's past COVID, but as we are now learning and understanding, there can be residual and long-lasting physiological impacts of the COVID virus in our bodies. So even though we have a significant number and very sad number of cousins who have passed, there's also going to be additional cousins who may in fact be carrying this virus with them for years. So cousins, let's take a look back at the past right quick. There were a number of issues that got us into this serious situation. We can think about we were too slow to close on some things. We were in a rush to open on other areas. We had inconsistent messages going from the top of the leadership of our country all the way down. There were not enough supplies earlier on. Remember, this is America. We didn't have enough supplies of PPEs and those kind of things. You know what I'm talking about. How could that be? But it did happen. When you think about it and you go back, cousins, COVID virus was, is, and will be a public health issue. It became a political issue for reasons that I don't understand, and I bet you don't either. The political issue turned it into an economic issue because we didn't listen to what the scientists and the public health people told us ahead of time, right? Simple. Not pointing in the fingers. Help me understand if that's wrong. And as I say, if I'm lying, tell me so. Cousins, a public health issue and COVID virus and our fight with it is still a public health issue. And so here's what we've learned. We've learned that masks work. We've learned that social distancing works. We learned that staying at home and powering down your lifestyle a little bit to protect not only you, because you may in fact be one of those fortunate ones that if you had the virus, it might be nothing more than a cold. Maybe even not that. because we know that a lot of cousins had it, were what they refer to as asymptomatic. It didn't even show up on their bodies. But guess what? They could transmit it to somebody else, which was the real danger and the sadness that so many cousins who passed experienced. So we know that, right? We also know that as a result of COVID, how about this one? I did some research on it and found out that, we talk about the flu season we have every year? There was a 98% reduction in flu hospitalizations across the country this year. Why? Because we were washing our hands, we were using our masks, we were maintaining social distancing, we were cleaning off surfaces. 98%, cousins. Now, I don't know about you, but I'm taking most bets with 98%, aren't you? So for those cousins who might have had difficulties, who had the flu and might have passed from the flu, that didn't happen nearly to the same records of numbers we've had in the past. Which says that as much as you may not like the way you look in a mask, you were doing the right thing for the other cousins. So here we are now, cousins. The vaccines are coming out. You've heard about the Pfizer vaccine, the Moderna vaccine, and now there's a Johnson & Johnson collaboration with another company vaccine that's coming out. All these vaccines are here for our benefit. Why? Because we need to have the vaccines in order to help us to get to the point that we have what they refer to as herd immunity, in which by vaccinated people and people who have already had the flu and hopefully have some antibodies associated with it, we get to 70 to 80% of the population. We have to keep pushing, cousins. It's the fourth quarter. So that fourth quarter means that we have to start taking the vaccines. For all of you who haven't done it, I'm going to tell you the story I'm telling everybody. Let me take a drink before I tell you this one. Cousins, in January, Pope Francis said that he believed that it's morally responsible for everyone to take the vaccine. Pope Francis in Italy, okay? Remember, Italy had a lot of problem with the vaccine, with COVID-19 rather, and the Pope is advocating to all the Catholics around the world to take the vaccine when it becomes available to them? Yes, because it's not a question of you and I trying to fix it. Well, I'm okay, and I think you're okay. We all have to become okay. And then now, unfortunately, in my favorite state, Texas, and some other states around, they're starting to say, well, we're going to reduce the mandate for wearing masks, okay? Because remember I told you last year, what does that say? That's like having a peeing section in a swimming pool. You can't put a limit around a vaccine, around a virus. It doesn't adhere to physical laws and principles like fences. So if Texas has some difficulty, opens up and has some difficulties, one of the most populous states in the country, what does that mean for the rest of us? Come on, cousins, our Texas cousins. I know that's what the governor said, and for a lot of good reasons, which I would assume are mostly economic, okay? Please continue wearing your masks, all right? Those cousins who have the operation, the businesses who are still in order, there's help coming, and they're going to be okay because the summertime and spring, it's going to work out. But we have to maintain that fourth quarter focus and concentration in order to beat this thing down. Okay? So we start having some things that are happening good for us. We're wearing masks. The rates are going down across the country. And then some of you younger cousins who are out there, oh my goodness, there's spring break coming. I even have a couple spring break memories myself. But cousins, let me ask you, do it one more time, give one more time and just don't go. Save the money to next year and for 2022 and it will be the blowout that we can all expect and want to have. Because we're so close, cousins, that we finally got the numbers trending the right way. The hospitals are able to support it. We got vaccines that are coming. They're talking about millions of vaccines coming out in the next, couple months? So who knows, cousins, maybe by the 4th of July, we might be able to get back to have picnics. Because let me be honest with you, cousins. If you come to my house and you don't have the vaccine on the 4th of July, you got to wear a mask and sit over on the other side of the pool. I don't have a pool, okay, but you can come to my house anyway. If you wear your mask on the other side, if you don't have the vaccine. Everybody else, we're going to be over here partying. Okay, you're going to be over there in the kids section. Okay, or you know what I'm talking about. The point is, get the vaccine, because the vaccine is going to help all of us to be able to move forward. And once you get the vaccine, what does that do? That helps everything else we want to get opened up, taken care of. Kids get a chance to get back to school. We get it back to having the socialization we want. We get a chance to start having those small businesses who need us so desperately to get back in business and start having their staff being taken care of and being safe as well. Cousins, it is certainly up to us. I've always mentioned that. It's up to us, you and I, individually. You make the decision, wear your mask, get the vaccine. And as soon as we do that, in this fourth quarter, cousin, we're going to beat this thing called COVID, and we're going to be able to start having more drinks together. So here's a toast to St. Patrick's Day and for all of us maintaining our discipline to hold the line for the fourth quarter so we can press and succeed in this hard fight, one of the biggest fights we've ever had. Wear your mask, get the vaccine, tell your friends to get the vaccine, tell your buddies, tell all the cousins, tell your family. There's nothing wrong. I've had my first shot. Guess what, cousins? I'm going tomorrow for my second one. So by the 1st of April, I'm going to be able to drink with almost anybody who also has their vaccine. Take care, cousins. I want you to take care of yourself. You can take care of me, and together we will beat this. Next week, I'm going to talk about some things associated with the relief bill that just came out. Stay tuned for that. Take care of yourself. We'll see you soon on Brown Liquor and Bad Ideas.
We are the people. We are the people.